Amazing. So hi, I'm Beth. I'm the new society training lead. So I'm kind of handling more of the society things as you might expect. But together with Becky, we're going to be kind of creating and providing all of the sessions for this year, starting with our sports first aid session. So that's pretty exciting. I'll give Becky just a moment to introduce herself.
Yeah, I'm Becky. I'm the unit training lead. So that means that if any of you are going to be on the unit next year, then I'll be sort of taking care of your training, making sure that everyone's up to scratch on their like clinical skills and stuff. So yeah, like Beth said, this is our first session, and we hope you enjoy it.
Yeah, amazing. So as I said, we're going to be doing sports first aid today. It's quite a wide topic, so we're going to be covering quite a few things in quite a short amount of time. But as Callum mentioned earlier, if you have any questions, just let us know and we'll kind of slow down and go through them. So this is informal training. All of the slides that we've created are created by us. They aren't created or approved or anything by St. John. So this isn't official training. And everything that we're saying is just kind of like a guide. It's all summarized in that slide, but the main takeaway is that this isn't St. John, this is us. Yeah. And then in terms of kind of well-being and mental health, there are sometimes some kind of distressing topics that we cover. Obviously, we're discussing like injury and things like that. So if you're uncomfortable, feel free to leave. And if you want to speak to anyone, then you can get into contact with me. I'm the welfare officer. So my email is just there. Alternatively, Nightline are running an email service. So yeah. Amazing.
And feel free to sort of join back in if you need to leave and take a break, then you can always come back again, I think. So
yeah. Thank you. Okay, let's get started. So as I said, there's quite a few topics that we're going to be covering. This is a summary and we'll just jump right in.
So the sort of first main thing that anyone's going to see in pretty much any sport I can think of, cuts and grazes. A lot of the time, if it's just a sort of smaller cut or a graze, then the most important thing is like always to just clean the wound and make sure that there's no sort of nasties lurking in there. So when you clean the wound, always clean like away from the site of the wound. And make sure that you're gonna like pat it dry and cover it with either a sterile like bandage, but in a sort of standard sports society first aid kit, probably a plaster if it's just a small one. And an important thing to remember with plasters is to make sure you use one that's an appropriate size, because if it's way too big, it's just going to be uncomfortable. And if it's too small and it sticks to like a part of the cut, it's going to be quite sore when you take it off. So that's sort of an important thing to remember. But from small cuts and grazes, they're sort of quite easy to control the bleeding just by a little bit of pressure and elevate the wound so that sort of the blood's draining away from it a bit more, just from gravity. And then if it's a sort of bigger one and if you are concerned about blood loss, remember to call 999. And if you're not really sure, there's always 111 as well, who sort of can tell you what to do. And yeah, in terms of cuts and grazes, I think it's something that quite a lot of people already know what to do, but just remember to clean the wound, pat it dry, and then cover with a sterile dressing.
Amazing. And then just going to head on to blisters. So blisters kind of simply are just fluid-filled bumps. So they're there to they're kind of the body's own plaster, as it were. They're there to protect and cushion the more sensitive tissues below your outermost layer of skin, and they form due to friction. So when your skin is repeatedly rubbed against another surface, so your trainers or something like that. In terms of first aid, it's really important to actually keep your blister intact. So no no bursting, nothing, just leave them as they are, because if you don't keep your blister intact, you're actually just creating an open wound, which kind of provides a site for infection to be introduced into the body, which is never a good thing. So main takeaway, keep it intact, and then You can wash the area gently, pat it dry, and then cover with a plaster again. Preferably in this case, a blister plaster, something like Compeed, because they're a lot better, and make sure again it's the appropriate size padding over it.
A quick thing to add with blisters is that you can, like, they're relatively easy to kind of prevent in day-to-day sport and like stuff like that. If you just get proper socks that fit and shoes that fit as well, it makes a massive difference. Just
definitely.
But yeah, nosebleeds. So nosebleeds can happen not just when you get like bashed on the nose, but also if you're sort of, I mean, I don't know if anybody else has this, but when you go swimming and you go from the cold air to the warm water and you get a nosebleed. But yeah, so sometimes they can kind of be a bit of a surprise, and not necessarily because you've been head-butted or something, I don't know. But the most important thing is to pinch the soft part of your nose and then tilt your head forwards. And this is something that a lot of people sometimes get mistaken or like have heard sort of wives' tales about. And obviously if you tip your head back, the blood's going to go sort of down your throat and there's potential to choke on it, which wouldn't be very pleasant. So head forwards, pinch the soft part of the nose, because you're trying to, in the same way that you put pressure on a cut, you're trying to just sort of put pressure on and help the blood to sort of clot and do its thing. So for up to 10 minutes. After 10 minutes, you release the pressure, and if it hasn't stopped, you just keep going with it for sort of 2 more rounds of 10 minutes, as it says on the slide. And then once it stops, just clean, but try not to sort of dislodge anything, because the blood will have clotted. If you dislodge it, it's just going to start bleeding again. So just gently clean with lukewarm water, just all the sort of external nasty. And yeah, and sort of just try and relax and like keep the heart rate down, because again, same thing, if your heart rate goes up, you're just going to dislodge that clot and it's going to start all over again. If it stops and restarts, reapply pressure. If it's really bad and you're again like concerned about blood loss, especially if they start to feel a bit faint, a bit dizzy, you need to sort of go to hospital, because it could be that you've got a bit more of a severe bleed and they need to sort of get you sorted out there. But main thing, head forwards, pinch the soft part of the nose, which can be quite uncomfortable. Has to be like quite a lot of pressure, but it needs to be done to stop bleeding. So yeah, that's nosebleeds.
Cool. And then just the last of our kind of quick fire, we've got a knocked out tooth. So knocked out adult teeth need to be reinserted back into their socket as soon as possible. The sooner a knocked out tooth is reimplanted into the socket, the more likely it is to re-embed itself into the gum. So time is kind of the essence here. So in the case of a knocked out tooth, it's really important that when you're kind of picking it up and touching it, you're only touching the crown. So that's the white part of the tooth that you can kind of see in your mouth. So just the kind of top part, the white part. And then you need to wash that under kind of cold running water for no more than 10 seconds if it's if it's dirty. And then it's just a case of pushing it gently back into the socket. You then cover the tooth with gauze and put some pressure on with your mouth, and it's a trip to the emergency dentist. If you can't reinsert the tooth, then it's then you're supposed to put the tooth in into some saliva. So you can either store the tooth in the cheek if the person whose tooth it is feels that that they're happy to do that. You can get them to spit into a cup and place it in there, or alternatively saliva-soaked gauze. And again, heading to the dentist. And these kind of this kind of system of things that you're doing also works for kind of chipped teeth. So if you find the fragment, you can store it into saliva, and the fragment can be glued back onto the tooth, but alternatively, like dentists can use a filling material if not. So yeah, saliva, I think a lot of people have the misconception of milk, but as far as I've kind of found, it's better to place it in saliva because it's got the right pH and things like that. So, yeah.
I think as well with younger kids, if it's like an adult tooth in a younger child, storing it in the cheek might not be the best thing because they might sort of swallow the tooth. I mean, anybody might, not just kids, but like it's more likely that a child will be like forget that they've got a tooth in their mouth that's not attached to their mouth. So just be mindful of like when you ask them to store it in their cheek that they need to understand that if they swallow it, it's gone forever.
Yeah.
So. Yeah. Right. Section 2. So, sprains and strains. Quite common in sports because you're all jumping all over the place or running fast or something. Again, a really good one to like be able to prevent. Because if you warm up properly before starting exercise, then your muscles will be warm and you're less likely to kind of pull them or stretch them in a funny way. So a sprain is when you injure a ligament, which is the soft tissue that connects bone to bone. Yeah, bone to bone. Yes. And a strain is an injury to a tendon or muscle. So a tendon connects the muscle to a bone. And I think it covers as well, like when you tear either of those things. So that would be like a more severe one and would probably take sort of going to the physiotherapist to fix in like the long term. But then if it's just like a stretched one, then you won't be in quite as much pain. They're still quite painful, but you won't be in quite as much pain and you should like recover on your own. So if you've sort of landed funny or something and then you've got pain and tenderness or you can't move the joint and there's like bruising and stuff, that's an indication of a sprain or a strain. And then in terms of treatment, you want to just get them to rest, like sit down in a comfortable position or sort of, you know, just get comfy basically. You want to ice the sort of site of injury, and that will help reduce swelling and bruising as well. And obviously the effects of bruising can last quite a long time, so the sooner you get ice on it and reduce the bruising, the better. And then C, which used to be something different, but is now comfortable.
Compression, but now it's comfortable support.
Yes, so just make sure that you support the joint and kind of, if you can, get some rolled up towels or some cushions sort of either side, just to make that person comfortable really, because they can be quite nasty injuries. And then finally elevation. So if you get them sat on the floor and then you've got a bench or a chair and you can put their leg up on it, or if it's their arm, like sort of put it up. So yeah, all of those are really, really important, and that's how you would go about treating a sprain or a strain. And I think that's everything I need to cover.
A little add in there really with the comfortable support. Things like conforming bandages, so the like tubular ones that you can kind of slip on are really good as well. And you can actually like leave a cold compress on and pop on a conforming bandage, and that's probably a good way kind of initially to start treating it. And
that, if you don't have ice as well, if you don't have access to ice, a cold compress will kind of help. It will be better than nothing. So like if you can just wet some sort of like a compress and get it cold and just pop it on as well. And in general, just like resting is a really like sensible way to heal a sprain or a strain in the long run as well. If it's not something that sort of requires medical attention, then resting it yourself should do. But if you're concerned, go to a doctor and then they can give you some exercises as well. So there you go, sprains and strains.
Okay, heading into a bit more kind of less likely territory.
Hopefully, anyway, we hope nobody breaks bones.
Hopefully we're not breaking bones. So the next kind of two things are going to be fractures and dislocations. So quite big ones, quite painful ones. So in terms of fractures, interesting chat, things going on in the chat. I got distracted. So in terms of fractures, recognition, obviously really, really severe pain. You might have some obvious deformity, but that's not like not hugely likely. I'm a radiography student. I deal with broken bones on almost a daily basis, and I don't often see deformity. So, swelling.
So don't count on it. Don't count on seeing deformity.
No, don't be like, my arm isn't bent, so I don't have a broken bone. difficulty moving, especially if you've kind of like whacked or fallen on a joint. And then there's crepitus, which is something that you kind of don't want to hear and you don't want to feel, and you're certainly not looking out for. But what it is essentially is kind of like a crackling, kind of crunching kind of noise when you're moving, which is just from the kind of edges of the bone not being a full bone anymore. Again, we're not searching out for it, but if it's something that you notice, it's probably a bad sign.
Can I just jump in? The thing with the crepitus thing is like it will cause them quite a lot of pain to move their affected sort of limb. So it's not something that like you have to hear to know that it's a fracture. If you have to hear it, great. But don't be like, you need to move that so I can listen for this horrible, horrible sound.
Yeah, exactly.
Yeah.
So for people who you might suspect have broken bone, the kind of most vital thing is that you're keeping that patient and that part of the body as still and supported as possible. So you aim to support the joints that are both above and below where they're getting the pain, and then immobilizing. So for a arm, you would be trying to do a sling in the most comfortable position that they're finding. So people with like elbow injuries and shoulder injuries will normally find it kind of most comfortable to have their hand across their stomach. Something like a collarbone, patients normally find it more comfortable to have their arm elevated, so with their hand kind of on the opposite shoulder, if that makes sense. And then in terms of legs, we can support and immobilize the injured leg by kind of attaching it to our unaffected leg. So we do a thing called a buddy splint, where we kind of essentially, tie the two legs together so they're supporting each other, and you can't move the injured leg, which is a good thing. And then you're going to want to get that patient to hospital so that they can actually figure out what's going on and take some x-rays and give them treatment. Arm injuries, usually you can transport to hospital yourself. Leg injuries should probably be transported by an ambulance because, again, we want them to be immobilized and keep as still as possible. So getting in a car when you have like a fractured femur is probably not the best idea.
Can I jump in again? In terms of like equipment that you can use, if you don't have, if you do have a first aid kit, brilliant. There will be kind of longer bandages and stuff that you can use to tie, like do buddy splints and stuff. And you always want to tie the knot on the side of the body that the injury hasn't happened. But if you don't have like a first aid kit, then you could use basically anything that's lying around that is kind of like clean and useful, to just tie the sort of injured legs together, or like create a sling. Like Eloise apparently has used her EUFAS jumper as a sling. So just so you all know, EUFAS jumpers can be used as slings. Double use, amazing. And award for commitment is that Eloise has fractured her elbow and still come to this session. So well done. And I hope you're okay. But yeah, so just use what you've got lying around basically if you don't have a first aid kit. That is a stash plug. Buy stash, guys. If next time that is an option, do it.
Yeah, amazing. And then kind of as an aside, while you're waiting for like ambulance to come, if they're coming, it's quite important that you're monitoring your patient or whoever's hurt themselves until they arrive, because broken bones are not fantastic, especially your long bones, so kind of humerus femur, tibia, and they can cause shock, which is a kind of rather nasty medical condition. So we're just kind of keep an eye out for your patient, make sure that they're kind of okay. And we'll be doing kind of more in-depth sessions on signs of shock and things like that a bit later on, but ensure that you're kind of keeping an eye on the whole situation. Yeah.
In short, I mean, you can sort of, shock can be determined by sort of clammy skin, anxiety, sort of feeling of dizziness as well. Sometimes people get. So just keep an eye out for like kind of what you might also associate with general feelings of anxiety, because that can be a sign of like very fast deterioration of your patient. And if that does happen, you want to keep them really warm, reassure them, and call for help straight away.
Yeah, definitely. Pop there. If none of their legs are affected, raise their legs up, keep them lying down, things like that. But again, we'll definitely do that more in depth in sessions to come. It's quite a big topic. So we'll head on to dislocations. So dislocations, treatment-wise, are really, really, really similar to fractures. They're just a little bit different. So obviously, dislocations occur when your bones are pulled out of their normal position within a joint. So this can be part or complete, and normally caused by like a strong force pulling on the bone, so pulling it into an abnormal position. Patients who have dislocations are experience a very, very kind of severe sickening pain. They're not able to move the joint, so don't try. There'll often be swelling and bruising at the joint, and again deformity from where the joint isn't where it's meant to be. So we absolutely do not try and put the dislocated bone back into the socket. This can cause further injury, like tendons and ligaments can become very, very damaged.
It can also like trap the sort of major blood vessels as well, which you really don't want to happen, because then you've potentially lost blood supply to that limb. So that's we definitely do not try and put it back in.
Yeah, definitely. We have a couple of questions coming through. So Jay has just asked if the recovery for dislocations is better or quicker than broken bones, since the bone wasn't actually damaged. It kind of depends on usually, yes, dislocations recover quite a lot quicker, but people can do quite bad damage to like ligaments and tendons that actually hold their joints into place. And if that's the case, these things are quite slow to heal. But usually dislocations are faster. Cosmo has said, do people need to go to the hospital if their bone pops out and then in again by itself? Yes. It's usually good to get these things checked out. Again, there can be kind of soft tissue damage, and you want to make sure that everything is as it should be. So yes.
And it's likely that that person will be in quite a lot of pain, even if it's popped back in. It's still really going to have hurt, and like again, symptoms of shock could set in. So just get yourself like to a hospital and make sure that you're all good. And don't straight back into the sport. Bad idea.
Yeah. So in this case, advice to keep still, support your limb in a comfortable position again, and arrange a transport to hospital. Yeah. Callum, is your brother home? Sorry. Callum.
Yes. Okay. Sorry. Hello. It took me a second there.
Do you want to stop screen sharing so that we can see?
We were going to do a quick sling demo. So Callum has enlisted the help of his brother for us.
Can you all see me, first of all? And can you all hear me?
We can hear you. Beth, if you turn your camera off, I think it should put Callum on the... Yeah. Yep. Okay.
Cool. I might not be able to hear you very well because I don't have a pair of speakers, so this is a pair of headphones, and it's complicated. Right. So, hi, my name's Callum. I introduced myself at the start, but I'm introducing myself again. This is my brother, who has kindly volunteered to be a injured casualty. Hello. We ensured that he was pre-injured by him going to the park. So I'm going to teach you about two different types of slings that can support an injury, and they both kind of they're mainly focused around different sorts of things. But the primary thing to talk about first of all is that the whole purpose of this is to make the patient comfortable. So if the patient is in a comfortable position already, don't go and kind of mess it up by forcing them to use a different the different position based on their injury. They will, you know, the patient will instinctively go to the most comfortable position for them, and your job is just to support them in that. So if they haven't gone to any position at all, by all means do pick the most appropriate one, but don't, you know, it's okay to use a different one if that's more convenient and more comfortable for them. So the first sling we're going to talk about is just kind of what you might see as your normal arm sling. So this is normally used for injuries. I don't know if you can see this bit, but it's injuries in kind of the forearm, lower forearm here. And it just supports it in a really nice and comfortable way. I'm going to teach you how to do it with a triangular bandage. You can do this with pretty much anything. Jumpers work really well because they kind of got a kind of a supportive main bit and then two bits that you can use to tie it on and support it. Scout neckers, pretty much anything really. So if you need to improvise, you can improvise. It doesn't have to be done properly. When you open up your triangular bandage, it is a triangle, so it has one point which has two short sides on the side of it, and this is where you're going to start. There's very many ways to do this, but I like to start off by just tying a little overhand knot in there. It's going to help the arm stay in later on, and I find that it's easiest to tie it first. You can also tie it at the end, or you can use safety pins, whatever works for you, honestly. But I find this way works the best and is easiest and most comfortable for the patient. What you're going to then do is remember kind of what you've just tied goes straight to the affected joint. So that was going to be the elbow in one of these slings. For this first sling, you start off by putting the bandage underneath their arm. So you might need to get them to kind of lift it away a little bit while you do that. It might be a bit uncomfortable for them. You can kind of wriggle it up inside if it's really a struggle. And then you can use the other side to come up and over. And you can ask the patient to support you in this. It doesn't have to be all done by you. You can kind of, it is a good idea, and people often feel a bit more comfortable if they're involved in their own care. So it's good to give people something to do. You then want to tie just a simple reef knot, and ideally, and this may not be possible in all people, depending on how their body shape and the sling that you're holding, but you want to tie a small knot on the top of the affected shoulder. So if they've hurt their left arm, you want to tie it just above the left arm. Okay, and it's not a massive issue if you don't. This is just kind of the ideal situation. Following that, just ask them to relax down into the sling, and this is really important just for you to check that it's nice and supportive. Now, if you can just turn around a little bit, Jamie, it probably won't fit perfectly straight away, so you can kind of tuck it in or do something to make sure the elbow is secure in there and it's not going to slip back out. This is where the knot comes in. If you're not suitable from earlier on, it's not in the right place, you can either use the safety pins that are normally included with a triangular bandage, just hold it in there, or you can just kind of undo it and tie another slightly better knot. Okay, I can run over any bits of this again in a second. The second type of sling is an elevation sling, and this is mainly to deal with injuries to the hand. So if someone's got kind of a cut or some kind of bleeding coming from the hand, if you put it in an elevation sling, it's going to lift it above the heart, which is going to slow the flow of blood. It's also, if there are any hand fractures or things like that, it may be a more comfortable position. And the final kind of main usage for it, but there may be others if the patient finds it more comfortable, is for collarbone injuries. Collarbone injuries are very, very painful and very hard to support without the proper equipment. So you're never going to get a perfect kind of job. It's never going to be really comfortable for the patient, but this tends to be the best way to do it. It's important to note with collarbone injuries, if Jamie had broken this collarbone here, I would be tying the sling across his body, avoiding having anything on top of the injured collarbone, because believe me, they will get very grumpy if you do that. They're not going to like you very much. it starts off in exactly the same way. So again, we find the point between the two short sides and tie a little small knot in there. But this time, instead of putting the sling underneath, if you can just pop your hand up on your shoulder, we're going to start off by putting the sling over the top. Okay, that's the kind of the main difference. You can the lower sling you put it underneath. With the elevation sling, you put the top face of the sling over the top, and then you can grab the bottom end of the sling and tuck it underneath their arm and bring it up. Exactly the same as before. If you can just carry on turning around, you're just going to tie that little reef knot, ideally, but if it's a granny knot, it's not going to really matter for this application. There. Now, the biggest thing that people do when they do elevation slings is they don't check it properly afterwards. Now, if Jamie was to relax down into it and I hadn't checked it, what can really easily happen is that their hand slips out from underneath. And that's why I like to call this sling the taco sling. So this is going to be really hard to demonstrate on camera, but so obviously you wouldn't do this to a real patient because they probably get quite grumpy at you. But if you can see there, it should look a little bit like a taco with two sides of sling either side and their hand in the middle, so that when they relax down and they pop their arm into it, you just relax down into it. You can check that it stays nice and supportive and in the right place. If it doesn't, you could by all means adjust it, change where it's tied at the back, make it a little bit tighter. There's all manner of things you can do to it. It's kind of a trial and error process. The great thing about this sling is if you do need to check that they've got circulation to that injured hand, you can easily access, for those of you who have covered it before, the capillary refill on their thumb there, which is really handy. Again, we do cover it in more detail in other EUFAS sessions if you would like to know more about that. Okay, so that's about all I had to say. Have there been any questions, Beth and Becky?
I don't think we've had any questions come through.
No.
But I just wanted to make another little plug here. I think there's some First Aid Fridays on the Instagram page, and I think there's possibly like ones about sort of the primary survey and secondary survey and things. So if you kind of are unsure of any of the things that we're saying, like things like capillary refill and things, it will be covered in there, and that's just kind of how you assess a situation and how you assess an injury. So those are also things you can look at and go to.
It's Annabelle's post on recap of observations covered as capillary refill.
There you go.
We just got a question from Jack Watts asking, what if they break both arms, Callum?
If they broke both arms, you're in a little bit of a situation. What I would probably recommend you do is find whatever works for that specific situation. That's not really something that is kind of generic catch-all advice. Look at the patient, see what kind of position they're holding their arms in anyway, and kind of develop a custom solution to build to that. It's really, really, and I can't emphasize this enough, it's all about your patient, what's comfortable for them, because what might be comfortable for one person is not comfortable for the other. When I broke my hand a couple of years ago, I wanted it down in a normal sling, not an elevation sling, because that was much more comfortable to me. It's entirely dependent on what's the most comfortable for that patient. So I can't give a proper answer to it, Jack, but I'm sure you can use your imagination.
I think we can say the proper answer is definitely not panic. Do not panic. And also, nobody break both arms on purpose just so you don't go to school for weeks. Also a bad idea.
That's sound advice there, Becky. Words to live by.
Amazing. Thank you so much, guys.
Yes, thank you. I got some serious Blue Peter vibes from that demo.
Yeah, it was amazing.
Are there any questions that anybody sort of wants answering? Jono's just added, you can put both arms in a sling if needs be and tie the arms to the body. Tie the arms to the body? Oh, so like, I don't understand.
If you get like you might have to tie two triangular bandages together. You do it in like a broad fold bandage, so they're like an inch or two wide. Tie them together, and then you literally just go all the way around the body, and it holds the arms to the body, so then they can move around a lot less.
Sure.
Means that likely to hit them on stuff.
Thank you.
Yes, but
Right.
if they do break both arms, you're definitely calling an ambulance,
Yeah.
and hopefully they will be able to assist you
Yeah.
with what might be the best, because they probably have a little bit more kit than you do. So that is always the option as well.
Yeah.
Apologies for that delay there.
No.
Okay, so spinal injuries. Spinal injuries are a big one. They can happen in like any sport, basically, especially like high impact sports where like stuff might get jilted out of, like I'm thinking about rugby, where if you like, I don't know how rugby works, but I'm sure that's that thing where you run into each other, and that's probably not good. Also, sports like trampolining, gymnastics, climbing, stuff where you're gonna be falling from great heights and things. They're really, really nasty because there's a danger that if the person can't recover from the spinal injury, they will be paralyzed from the point of the injury down. So recognition of a spinal injury is really important, because if you've had a fall and you've kind of not recognized that the person might have a spinal injury and then you move them, it could make it so much worse. So if they've got pain in their back or their neck, or if they've kind of got an abnormal look to the spine, so if they've like landed in a funny way and it looks like the spine might be deformed, bruising of the spine, if they can't move their limbs, that's a really kind of big indicator of a spinal injury. And if they can't feel their limbs as well, and then potentially like sometimes you can lose control of like your bladder and your bowel. So another important point to remember there is like remember about the patient's dignity, and just like, you know, if that's happened, maybe don't let a big crowd of people kind of gather around. Just get one or two people to help you and then say like, we've got it under control. And yeah, and also breathing difficulties, because sometimes it can affect the lungs if you've kind of got things that are out of place inside the body. So once you've like recognized that they've got a spinal injury, the big important thing is like, do not move that person, because as I said, the more you move them, if it's an injury like of the spine, the more likely that is to then move and like sort of cause further damage. So don't move them. The best thing you can do is keep their head steady, and if they happen to land like flat on their back, arms by their side, keep that head, neck and spine all in a straight line. You want to sort of take the side of their heads in like a Spock-like motion so that they can still hear you, because they'll be in a lot of pain, and if they can't hear you and can't hear what's going on, they'll be really, really anxious. So make sure that like you kind of hold the, I can't do it on myself, but you hold the top of their head with their kind of Spock hands over their ears, so that they can still hear, and just keep everything still and steady. And you can use like rolled up blankets and towels. The first thing you need to do when you suspect a spinal injury is call 999 really. And then make sure as well that while you're doing that, somebody can sort of see like there's no major bleeding anywhere and stuff like that, just to make sure that everything else is okay and there's no life-saving action needs to take place. But just, yeah, keep everything steady. I think we've got a demo video for you to see that will show you how to do the Spock hands and keep them still and things. So yes, 112 is also a number that you can use in the UK.
If you think they have a spinal injury, reassure the casualty and advise them not to move. Call 999 or 112 for emergency help. You should then kneel or lie behind the casualty's head. Rest your elbows on the ground or on your knees to help keep your arms steady. Hold each side of their head with your fingers spread so their ears are not covered and they can still hear you. Support their head in this position so the head, neck and spine are aligned. While you support their head, ask a helper to place rolled up blankets, towels or clothes on either side of the casualty's head. Make sure you continue to hold this position until emergency help arrives.
Is that the end of the video? Yes. No. Yes. Oh. Yes. So like she said, yeah, just keep the head steady, use towels. It's really helpful in that situation if you've got like a kind of teammate helping you as well, because
Mhm.
if one person's holding the head steady, they can't do everything else as well. So yeah, Beth, do you have anything to add for spinal injuries?
I mean, what's the time? I have a quick story time if we want to bring those back.
Oh, we do. Tell us a story.
Amazing. So this is about a potential missed spinal injury. So my sister a few years ago fell off her horse, and she went to A&E and was in quite a lot of pain, but also she was like so high off of adrenaline that she also kind of couldn't feel any pain. So her priority was getting home. She was like, I just want to leave, I want to go home. And so the doctors in A&E, they x-rayed her collarbone and her shoulder because that's where she felt like she was getting most of her pain. Couldn't find anything, and they were like, okay, go home, fine. And a few days later, she went back to A&E because she was getting really bad pain in her spine. And the consultant in A&E was like, oh my gosh, like, oh, we need to get you in a collar straight away. Like, we think you've broken your back. And she was like, well, there's kind of no point. I've been walking around for the past 4 days, absolutely fine. And I think potentially it's just kind of like a lesson in this case of if there's a really high impact injury, for example, falling off a horse, adrenaline is quite a powerful drug and it really means that you can't feel much pain. So if you're like suspicious and you're like, hey, this could have resulted in something bad, like treat it seriously, and try not to get into a situation where your patient's going to A&E, 4 or 5 days later. And in that case, them being like, yo, we should probably put you in a spinal collar. So yeah, story times.
Yeah. So actually, you raised an interesting point going back to fractures and things. Adrenaline is a really, really powerful drug. And some people will walk around on a fracture for days before they notice that something's wrong, or like before they kind of think, oh, this might be a bit more serious than I thought. So it's like quite important to kind of know when to recognize it, like mottled skin, swelling, stuff like that, because that person might not be thinking straight. They might think, oh no, I'm fine, I'm just going to carry on playing this game of netball.
Yeah.
And then they'll do, you can do permanent damage that way. Whereas if you get it treated straight away, then it will be most likely like healed a lot better. So remember that adrenaline exists. And so if it looks like somebody's kind of fine, just make sure you check them over for any of these injuries that we've kind of discussed.
Yeah. Cool. Heading on to concussions, which is the slide before
this. Slide before this, yeah.
Sorry.
Sorry, 1 second.
That's okay. No worries. So yeah, we're going to be talking about concussions next. A concussion essentially is just they're a temporary head injury caused by a blow to the head usually. There is a huge range of symptoms that are kind of encapsulated by concussions. And obviously, because they're an injury to the head and to the brain, it's quite important to be clued up to what you need to recognise, because medical attention is and advice is really important to ensure that no kind of more long-term damage is being done. So I'm just going to run through kind of some of the more typical things that you might expect to see when someone has a concussion. So we're talking things like headaches, ringing in the ears, nausea and vomiting, fatigue, drowsiness, confusion, dizziness. You can get temporary loss of consciousness, delayed response to questions. It kind of just goes on and on. But essentially, if someone has had a blow to the head and you notice that they aren't acting themselves, and if they're getting these kind of fatigue, drowsiness, and nausea symptoms, it's really, really important for that patient to go and seek medical advice. And especially if you're noticing signs of a worsening head injury. And kind of on the note of return to sports that we've been kind of having throughout, if you have any symptoms of concussion, it's very, very important that you're not returning to a sport where you could have a further head injury, because they can kind of just kind of build up, and the damage that you can actually be doing can get worse and worse. So yeah, never return or play like vigorous sport with signs and symptoms.
And that counts for like not just immediately the day that you get the concussion as well. That counts like if you're still experiencing symptoms 2 weeks on, do not return to the sport.
Yeah.
That's the point. Like, a lot of people think, oh, well, I'm still having symptoms, but it's been more than a day, so I should be fine. But they can last up to, I mean, I don't know, I'm pretty sure they can last upwards of 2 weeks. So
yeah,
just don't return if you've still got any sign of a symptom.
Yeah, exactly.
Okay. So asthma, I think this is our last one before the next group. Asthma is a sort of respiratory issue. So it's when the airways kind of go into spasm, they shrink and get smaller, so you can't get as much air into your lungs. And there's like, it doesn't necessarily have to be caused by sport. A lot of people who have asthma like experience worse attacks when they are kind of running around and exerting themselves, but it can just be caused by kind of allergies, pollen in the air, sort of just having a bad cold, and things like that. So it's not like strictly related to sort of sport, but it is exacerbated when you're doing things that involve like your lungs, which would be living. But anyway, recognition. So if you're struggling to breathe, or if you're kind of wheezing, coughing, and then because you're getting less oxygen into your body, you might feel like really anxious and distressed, and kind of sometimes that can come before you've noticed that you're having breathing difficulties. So that's kind of important to keep an eye out for. If you know your mate's got asthma and they're really agitated but aren't like visibly wheezing, it might be because they've got an attack coming on, or they're having like a milder attack that kind of could worsen. So watch out for that one. So if you've got someone that's experiencing an asthma attack, get them to sit in a comfortable position, preferably in a position that opens up the airways. So I think, is this where you could sit on the back of a chair and like lean over it to open the airways?
So that's breathe it. Is that what it's called?
Anyway, but just get them to sit in a position that's comfortable for them, because you know everybody kind of has their preference, and then they'll use their reliever inhaler. A lot of asthmatics have a preventer and a reliever inhaler, and they should carry the reliever around with them. The likelihood is, if they know they have asthma, they'll know how to deal with it themselves. But if they're having an asthma attack, you might get scrambled brains, might not know what to do. So get them to use their inhaler. 1 to 2 puffs every 2 minutes for up to 10 puffs. So if they've had 10 puffs, then stop. I think you wait for 15 minutes, and then if symptoms are persisting, they can do the same cycle again. If they are using their inhaler and they're not getting better, or they're getting worse, then you need to call 999. If it's a really severe one and they struggle to even take their inhaler, you also need to call 999. And then if they've entered the sort of second cycle of that medication from the reliever inhaler, you also need to call an ambulance. Just, because it can go from bad to worse really, really fast, and they can deteriorate very quickly. Obviously, oxygen's quite essential, so it's useful to have, I find. So yeah, basically just sort of monitor them. If it looks like they're better, just get them to rest. And if they feel that they need medical attention afterwards, then help them find it. But the most important thing with this one is kind of like help them feel comfortable. If it's a milder attack, because it can be really like distressing.
And a quick note on that wheeze. Sorry, a very kind of characteristic thing with asthmatics who are having an asthma attack, the wheeze is on exhalation, so it's quite a high pitched sound, and it will be associated with them exhaling rather than inhaling, which is quite characteristic of asthma. So
yeah, it's not the same as like a lot of people when they're out of breath would gasp for air, so that's like you'll notice it on the inhale. So, but with this, it's on the exhale. Yeah, I think we got one person to talk about asthma, didn't we? That should have been your one. So yeah, does anybody have any questions about the last sort of few things we've discussed before we move on to our final Kahoot? We'll give you some time to type if you have any questions.
We had quite a lot of stuff in the chat about the seriousness of concussions and kind of the impact that that's kind of having on sports nowadays. So the concussion care. I know that the gymnastics, the gym that the gymnasts use at our university have like a doctor on site who does concussion checks, like whenever someone gets dropped and things like that. So yeah. It's asked, what should you do if you have an asthma attack and the person has no inhaler?
So actually, yeah, I forgot to mention that. So it's kind of an answer to your question, but not. A really important thing is if they don't have their inhaler with them, but somebody else does, do not use that other person's inhaler, because there can be slight differences. And, you know, like hygiene and just so many things. Just don't ever use medication that's not for that person. So that's, yeah, like if that person doesn't have an inhaler, don't just use a random one lying around. They should have one on them. If they don't, you just need to call an ambulance, try and get them to sit comfortably, try and reassure them and relax them, because things will get worse if they start panicking and then like hyperventilating. So just reassure, wait for help to arrive. If they ever go unconscious and stop breathing, you would have to commence CPR, which is such a big topic, we can't talk about it now, but there are sessions online and stuff on the Thursday, Fridays. So, yeah.
Yeah, definitely.
The other thing to say on that is that the likelihood of that happening is probably fairly low, because most asthma attacks are fairly mild anyway, and most people who have asthma do carry their inhaler on them.
Yeah, especially if they're very active people and know that they're doing sport and like are likely to have an asthma attack. So
yeah, and it could be that just sitting down for a couple of minutes and not running anymore might be enough to stop it if it's a mild attack. So if it's severe and they really can't breathe, then you're going to call an ambulance straight away. But if it's only a mild attack, maybe give it a couple of minutes. If they don't start to improve, then that's when you want to kind of think about next steps.
Yeah,
I think if you can and it's nearby and it's easy, if you can get them indoors, especially when it's like cold outside. I have asthma and I find it very, very difficult if I'm kind of on the verge of an attack or having an attack to breathe cold air. So I try and get myself inside because it's a bit easier.
So yeah, just to say thank you to you all for joining as well. It's been a real pleasure. I've missed doing EUFAS sessions, so it's really nice. Thank you to everyone who has participated.